In general, it is responsible to initially administer a moderate amount of inexpensive crystalloid up to a liter if the patient is oxygenating well. Infusing greater amounts may contribute to tissue edema, commonly impairing oxygenation. Colloids should be selected if additional volume is required. The selection of colloids should be based on the patient's pulmonary and renal function and the extent of mediastinal bleeding. Albumin 5% provides excellent volume expansion, approximately 400 ml retained per 500 ml bottle administered, and has primarily dilational effects on clotting parameters. Also, it is a saline-based colloid. 5% albumin does preserve coagulation better than first-generation hydroxyethyl starches in saline, and arguably better than colloids in balanced salt solutions. It has oxygen-free radical scavenging and anti-inflammatory properties which may exert protective effects on the kidney. Also, albumin is effective in expanding the intravascular space. It does leak into the interstitial space due to the capillary leak and may cause movement of fluid out of the intracellular space. Albumin has a half-life of 16 hours and leaves the bloodstream at a rate of about 5-8 gram/hour. Hydroxyethyl starch preparations are non-protein colloid volume expanders. They are characterized in part by their molecular weight in kilodaltons and their molar substantiation, which characterizes the rate at which they are broken down into smaller fragments. The first generation hydroxyethyl starch are high molecular weight solutions and include Hespan 6% hetastarch in saline and Hextant 6% hetastarch in balanced electrolyte solution. Both are more than 600 kilodalton and 0.75 molecular weight. They provide excellent volume expansion that decreases gradually over the ensuing 24 to 36 hours. They are retained in the intravascular space better than 5% albumin in conditions of capillary endothelial leakage. Concerns about the use of hydroxyethyl starch preparations center around their effects on renal function and their potential to cause a coagulopathy. Also, the high molecular weight compounds are more likely to cause renal dysfunction than the lower molecular weight ones. None appear to be immune from this problem. Furthermore, despite some claims that hextant and the low molecular weight hydroxyethyl starch solutions can cause less of a coagulopathy than Hespan, all appear to be associated with postoperative bleeding. Hespan may contribute to a coagulopathy by binding to the von Willebrand factor 8 complex, causing platelet dysfunction and also contributing to fibrinosis. Studies have shown that it is used during cardiopulmonary bypass and even with off-pump surgery increases the risk of postoperative bleeding. When used postoperatively for volume expansion, the dose should be limited to 20 ml/kg to minimize the risk of bleeding. Obviously, it is best avoided entirely if the patient is actively bleeding. These concerns about bleeding lead to a United States Food and Drug Administration warning to avoid use of Hespan in cardiac surgery patients during surgery and the immediate postoperative period. Hextant provides similar volume expansion as Hespan. Also, some studies suggest less of an impact on coagulation than Hespan, Other studies have demonstrated a similar decrease in claw tensile strength as Hess pump with a comparable adverse effect on platelet function. Extent has been associated with increased blood loss after cardiac surgery, and thus the dosage should similarly be restricted to 20 milliliter kilogram. Low molecular weight compounds include pentastarch, 6% hydroxyethyl starch, pentaspan, available in Canada and Europe, and tetrastarch, voluven, available in the United States. It is recommended that daily doses of these two compounds be limited to 28 milliliter kilogram and 50 milliliter kilogram respectively. These compounds produce volume expansion comparable to the first generation compounds. Also, the volume effect is of shorter duration, estimated to be at least 6 hours for tetrastarch because of more rapid elimination. Both are associated with less risk of renal dysfunction than the high molecular weight compounds and might have less impact on coagulation. An increase in tissue oxygenation has also been demonstrated with Hess 130 0.4 compared with lactated ringers, perhaps because of better microcirculatory flow. Thus, the lowest molecular weight Hess, such as tetrastarch, may be the safest Hess for volume expansion. Also, the duration of effect is less than with the highest molecular weight Hess. In Europe, gelatin solutions have been used effectively for volume expansion, but because of the risk of life-threatening anaphylactic reactions and renal dysfunction, they are not available in the United States. Several comparative studies of 6% Hess, 6% Hess 200, 3% modified fluid gelatin, or 3% urea-linked gelatin demonstrated that all of these solutions were effective volume expanders. However, there tended to be more bleeding noted with the Hess 200 0.5 solution.